Thank you, Dr. Shifta, for a nice introduction. Assalamu alaikum and very good afternoon, respected chairperson, panelists, and the dear audience. I know all of you are very tired, but I confirm you that my topics is very simple and very short. So let's move. So two back-to-back breast cancer presentation. My one is on the HER2 positive breast cancer. So you know, breast cancer has evolved in the recent decade, and it has become very clear that optimal therapy for breast cancer is driven by molecular subtype. And one-size-fits-all approaches to therapy selection are not relevant in current era. So we have four categories: luminal A, luminal B, HER2 enriched, and triple negative or basal-like. We'll be concentrating on the HER2 only. So HER2, what is HER2 positive breast cancer? HER2 is a protein that remains in the transmembrane, which is overexpressed, is called a HER2 positive breast cancer. And overexpressed HER2 breast cancer is very aggressive in nature, rapidly progressing, and there's a higher chances of the recurrence. Early detection and personalized treatment are crucial for improvement of the survival. When HER2 gene amplification is done, it results in marked overexpression of the HER2 protein. You see, there's a thousand and thousand of protein in the target cancer cells. So we have many targets to treat. Before 1995, HER2 positive breast cancer was the most aggressive type of breast cancer. It was very difficult to treat and very difficult to survive. But after that, when the trial has been given with this anti-HER2 therapy with trastuzumab, it has been approved in 1998, first time, and applied because of this study has shown, though it was a phase 2 study, but it has shown clearly that the results was amazing. So that is last 15 over the 15 years, the advances has done from the trastuzumab and so many molecules to treat the HER2 receptor. So what about this percentage? Why we are so concentrating on the HER2 positive breast cancer? We all know the breast cancer is very common in women, also in Bangladesh, along with the worldwide. In 2022, breast cancer accounts for more than 19,000 new cases and representing 12% of the all cancer in the women. And globally, in HER2 breast cancer, positive breast cancer was 20%. But what about the Bangladeshi one? Do you have any study or do you have any documents? Let's see. In Bangladesh, breast cancer, 6,000 deaths occur in 2020, and I'm sure there's advanced HER2 breast cancer contributes a lot in this death. So my one is also not a breakthrough study, it's just observational, and we know that keeping record in Bangladesh is very difficult. We are lacking behind, and it is more personalized, not on the hospital-based. So this is my record from a single institute where from the 2017, I have tried to keep record on the patients. So we evaluate 157 patient, 54 patient, and the median follow-up was 2.5 years. And there is some, we are more concentrating on the chemotherapy regimen and what we are using and how they are treating. This whole number, I found that HER2 ERPR positive and HER2 negative patient was the most prevalent one, and which is assumed. It was 39%, and after that it was TNBC, which was quite surprising. It was 37%, and HER2 positive breast cancer was 23%. We'll be concentrating on the HER2 positive breast cancer patient only. The age range, the highest number was among the 51 to 60 years. And the percentage was quite high, it's 39. And below that, the second range was 41 to 50 years, that is 31%. So I found that quite interesting. The HER2 positive breast cancer is quite, in the middle age is the most prevalent one. And below 30 and above 60, not that much. What about the grading? The grade 2 was the highest in number, below that grade 3 as well. That is the substantial level, which was 25 in percentage. We try to correlate with the age and the grading. Is there any correlation with the age and grading? We found this grade 2 tumor was found in the 51 to 60 years old group. Grade 3, we were assuming that grade 3 will be in the younger age, but my patient profile doesn't show that. It said that grade 3 is found spread equally to the all range group. Tumor site. Tumor left breast was the highest number and significantly higher than the right breast. And tumor position. Tumor position, I found that 57% was located in the upper and outer quadrant. And maximum, around 90% was in subductal carcinoma, and other few was the lobular carcinoma and mucinous carcinoma. What about the T and N stage? T2 was the most frequent one, followed by T3. And N1 was found highest, followed by N0. If we do the stage grouping, we can see the patients come with a higher proportion patient comes to us with the advanced stage. That is 2A, 2B, and 3A. That comprises the most of the disease, most of the patient. We try to find out the correlation between the age and staging, and surprisingly, it is more aggressive in the younger age, that is the 30 to 40 age of group. It is more, they can come with a very advanced stage 3A and 3B. What was the chemotherapy protocol we used? We used normally, the maximum was the AC followed by docetaxel was the highest one, followed by AC followed by Paclitaxel, and some other few chemotherapy protocol. This is the most important slide, I think, in my whole presentation. That is the number of the patient who can afford the trastuzumab anti-HER2, because we all know anti-HER2 is important to treat the HER2-positive breast cancer. But in our constrained, limited setting in Bangladesh, where patient has to treat with the out-of-pocket, own pocket, it's very much difficult to treat anti-HER2 with the anti-HER2. So this slide shows clearly that more than 50% patients are unable to treat with the anti-HER2 because of the I think financial toxicity. So our patient, this slide also is very interesting. We have previously you will see that most of the patients were mastectomy was done, but our patient, we have 41% patient with the BCS. This showed they are more trained of doing the BCS right now. And because of the BCS, we have almost 86% patient we received radiotherapy. What about the survival? If we represent one is the survival rate, patient who received trastuzumab, they have 100% survival at present. But who didn't receive the trastuzumab, they have a lower survival rate. So, as I told you that a patient who didn't receive that anti-HER2 therapy, they have few patient has recurred and they died of the few patient, and survival was not because few of them are also ER/PR positive, though they didn't have the anti-HER2, but they also received the hormone and therapy. So my key findings was the age distribution was below from the 28 years to 67 years. But the majority patient was in the group of 51 to 60 years group. And treatment regimen, breast conserving surgery with axillary clearance is practiced more than before. More effective chemotherapy schedule with AC followed by docetaxel. And about 44% patient received only trastuzumab. And survival rate who receives anti-HER2 are 100%. So in my conclusion, I like to say that trastuzumab improves overall survival, but is financially incredibly inaccessible for the most of the patient. Early diagnosis is crucial for effective treatment planning. ER status is also impacted in overall survival, and addressing affordability of trastuzumab is essential for better outcome. So I'm requesting all it's very important for our nation to make it accessible for anti-HER2 therapy for HER2 positive breast cancer patients. Thank you so much.